Your cat's eyes can tell you a lot: a little crust at the corner, a wet tear stain on the fur, a slight squint, and those small signals deserve your attention. This video walks you through a calm, safe routine you can use tonight: how to prepare the space and tools, how to approach so the cat cooperates, the exact cleaning technique that avoids pain, how to manage common problems, and the unmistakable signs that mean you must stop and call a veterinarian. Everything here is practical, gentle, and built to protect the eyes while building trust. Begin by setting the scene. Choose a quiet, warm spot your cat already likes. A low armchair or a lap with a soft towel works well. Bright overhead lights, cold tile, and sudden noises make cats tense and increase squirming. Gather only the things you need: single-use sterile saline vials or a veterinarian-recommended eye wash, lint-free gauze squares or sterile gauze pads, a soft towel to wrap the body lightly if necessary, and a small bowl of warm water to warm the saline. Do not use cotton balls that shed, do not reach for human eye drops unless prescribed, and avoid alcohol, hydrogen peroxide, or homemade mixtures. Warm the saline between your palms for 10 seconds so the wipe feels like grooming. A lukewarm pad reduces surprise and lowers stress. Before you begin, put the warmed vial where the cat can sniff it for a minute so the product becomes familiar. Approach with consent. Move slowly, speak softly, and come from the side rather than over the top. Let the cat smell the pad and the vial first. Watch body language closely: slow blinking, relaxed breathing, and a forward lean mean you can proceed. Flattened ears, a twitching tail, or wide pupils mean pause. Offer a tiny treat or a short calm stroke to create a positive association. If the cat pulls away, stop and try again. After a minute of gentle petting, forcing increases resistance and makes future sessions harder. A few simple rituals, a soft voice, steady hands, and a pause for a sniff, change the whole experience. Support the face to protect whiskers. Whiskers are highly sensitive and pressure on the whisker pads triggers a reflexive pull. Rest one hand gently under the cheek or jaw to steady the head while the other cleans. This feels like natural grooming and dramatically reduces flinches. Avoid gripping or tight restraint. Gentle stability works far better than force, and cats are far more willing to accept short handling when they feel safe. Soften crust before wiping. For loose crust or dried tear material, soak a pad in warm saline and hold it on the closed lid for 20 to 30 seconds to loosen debris. Then sweep once from the inner corner outward with a fresh pad and discard it. Never wipe back toward the nose and never reuse the same pad on the other eye. If crust remains after one softening and one sweep, stop and try later. Repeated scraping inflames the area. Practice this softening and sweep method tonight: one gentle warm press, one smooth outward pass, then praise. That single pattern prevents most accidental scrapes. Treat each eye as its own issue and avoid cross-contamination. Use a new sterile pad for the second eye and change hands if you need to. Thin, clear tearing usually responds to gentle cleaning and monitoring. Thick, colored, or foul-smelling discharge suggests infection. In that case, clean once gently, record the color and smell, and call your veterinarian. If the cat keeps the eye closed, blinks excessively, or shows pain, seek same-day care. Resist the urge to squeeze swellings or lance lumps, that causes more harm. Watch the blink rhythm. A slow, deliberate blink during handling is a sign of trust. Rapid blinking, squinting, or repeated tight closure signal discomfort. If blinking accelerates, pause for 10 seconds, offer calm praise and a tiny treat, then try a more delicate single sweep. Cats remember pressure. One bad session can set you back a week. Pausing to reset stress is always better than pushing through. If a foreign body caused sudden squinting or tearing, a grass seed, dust, or a tiny fragment, and you can clearly see and remove it with a single saline wipe, do so gently from inner to outer corner. If the object does not come away instantly, if the eye becomes red or cloudy, or the cat paw at the face increases, seek urgent veterinary care. Never use forceful irrigation at home or over-the-counter numbing drops unless specifically instructed by a vet. These can mask pain and worsen injury. Long-haired cats need a special approach. Fur traps tears and debris, creating tight mats that irritate lids and cornea. Keep the hair trimmed safely around the eye or use daily saline wipes to prevent matting. If tight matted fur forms close to the eyelid, consult a professional groomer rather than cutting too close yourself. Improper clipping risks injury. For persistent tear staining on light fur, discuss with your vet whether eyelid position or tear duct issues might be contributing. Medications and topical treatments require exact technique. Never apply human eye drops without veterinary direction. If your veterinarian prescribes drops or ointment, follow these steps. Keep the cat stable and calm. Tilt the head slightly, pull the lower lid down to form a small pocket, place the drop into that pocket without touching the eye with the applicator tip, then release slowly. If the cat resists, split the dose into 2 quick attempts instead of a single prolonged hold. Pair medication times with feeding or a short play cue so the action becomes predictable and reduces resistance over time. Record a short symptom log. Note when tearing began, whether it affects one or both eyes, the color and consistency of any discharge, and related signs such as sneezing, appetite change or pouring at the face. A brief video clip of the eye behavior helps a veterinarian diagnose faster. If eye symptoms accompany lethargy, fever, nasal discharge or appetite loss, do not treat the eye alone, request a full examination. Environmental steps matter. Keep scented shampoos, aerosol sprays and dusty litter away from resting areas. Trim fur around the face, maintain parasite control, and keep oral health up to date. Dental issues can contribute to secondary eye problems. Clean bedding regularly and reduce exposure to smoke or strong household chemicals that irritate mucous membranes. Build a 7-night conditioning routine rather than one big cleaning event. Nights 1 and 2. Introduce the kit without cleaning, let the cat sniff the warmed saline and the pad while you offer treats. Nights 3 to 5. Perform a single softening and sweep per eye and immediately reward calm. Nights 6 and 7. Simulate a brief handling check so the cat accepts touch near the eyes as routine. This gradual conditioning reduces stress far more reliably than sporadic forceful attempts. Know the emergency signs. Severe squinting, a bulging eye, sudden loss of vision, thick green pus, heavy bleeding or an eye that will not open are emergencies. Transport the cat in a secure carrier and seek urgent veterinary care. These signs can indicate corneal ulcers, penetrating injuries, glaucoma, or severe infection that require immediate treatment. A few advanced tips many owners miss: keep a compact eye care kit near where you sit at night, single-use saline vials, pre-folded sterile gauze and a soft towel. Use scent layering to help long-haired cats. Rub a towel on the cat's chest and then place that towel near the cleaning spot so the space already smells familiar. If the cat has chronic tearing, your vet may suggest imaging or a lacrimal duct assessment. Persistent staining can have surgical or medical causes that need evaluation. Do not ignore behavioral changes. Sudden avoidance of being touched around the face, increased aggression when you reach near the head, reluctance to jump or play, or changes in litter habits can be signs of pain or systemic disease. When unsure, film a short clip and consult your veterinarian. Early evaluation prevents weeks of discomfort. Finally, a clear nightly plan you can use this week. Night 1 and 2, warm the saline and let the cat sniff the pad while you provide calm attention. Nights 3 to 5, perform one warm softening hold and a single outward sweep per eye. Keep each session under a minute, and reward calm with quiet praise or a tiny treat. Night 6 and 7, practice brief handling tolerance and evaluate whether to continue nightly gentle wipes or schedule a veterinary check if problems persist. Keep a simple nightly note of what you tried and what changed so you can report concise information to your vet if needed. Try one small, safe change tonight and test it for 7 nights. Tell me what improved in the comments and check the playlist Why Cats Do That for more practical, science-backed cat care tips.